is Michelle Genovese. This is going to be my informative speech for Anne Arundel Community College's Communications 111. This is my outline, and this is my visual aid. It's summertime, and it's getting warm out, so you're out driving around, have the windows down in your car, listening to great music,
Hey, Mama.
driving around, and all of a sudden, wham, out of nowhere, someone slams into the back of you. And you think, when the smoke clears, I'm okay, and you go on about your day, and for the next week, everything seems fine. But after about a week, you wake up one morning and your back feels locked up and tight and you can't move. And you think, I have so much I have to do today. Who's going to do all this stuff that I have to get done? And you think, there's no way that you can live like this. Well, there are chiropractors in your area that can help you with back pain. I want to begin talking today about the origin of chiropractic. According to the American Chiropractic Association, chiropractic treatment has been around since the beginning of recorded time. As of the late 19th century, in the U.S. is when spinal manipulation began. In 1895, Daniel Palmer founded chiropractic as a profession in Davenport, Iowa. Throughout the 20th century, chiropractic has gained legal recognition in all 50 of the U.S. states. Doctors of chiropractic are considered founders and pioneers of non-invasive therapy and care along the complementary and alternative medicine treatments. Now that you've heard a little bit about chiropractic and where it began, let's talk about some of the things chiropractors help treat. I'm going to use my visual aid and show you that chiropractors treat neuromusculoskeletal disorders, which include neck and shoulder pain and any kind of muscles that contribute to the movement of them. All types of back pain, whether it be upper, mid, or lower back. Headaches are usually caused by a pinched nerve located in your upper back, usually corrected with a spinal adjustment. Extremity pain, which includes hands and feet. Sciatic nerve pain, which your sciatic nerve is in your very lower back and travels down your leg. Jaw pain, such as TMJ, which is a disorder with opening and closing of the jaw. And allergies, asthma, and many other things. A lot of people that have seasonal allergies seek chiropractic treatment and helping clear up the congestion that they sustain from that. These are all from the National Center for Complementary and Alternative Medicine. Now, I'm sure you're thinking to yourself, I suffer from at least one of these. And you probably think that chiropractors only treat back pain. But chiropractors do work on a case-by-case basis. Now I want to tell you a little bit about what an appointment with a chiropractor entails. The first appointment begins with a question and answer session where you come into the office and meet with the chiropractor, and then when you meet with the chiropractor himself, he asks you many questions, almost like an interview type process, saying, when did this begin? How long has this been going on for? Did you have an injury that caused this pain to begin? And every treatment that you've used or tried to help relieve this back pain. Following the assessment following the question and answer time, there's the assessment, which includes some feeling the chiropractor will do on the body part that's bothering you. Just kind of like a little bit of soft touch and poking, trying to figure out what exactly the issue, the underlying cause of the pain is. After the assessment portion, they have the diagnostic portion where they may refer you to outpatient for a diagnostic test. The only reason that they would do that is if they consider it to have a serious underlying condition. Some of the diagnostic testing includes x-rays, which are mainly used for bone and back pain, CAT scans, which they use primarily if they feel the patient is a candidate for surgery, and MRIs, which they use for chronic back pain or suspected spinal stenosis. After they get all of the results back from testing, they meet with you for a second appointment and go over recommendations that they feel will be best for your care. As I said before, chiropractic is based on a case-by-case basis, so no two patients' care plan is going to be the same. Now that you're aware of how the first appointment goes, what are you waiting for? Are you still unsure if chiropractic care is something that you would benefit from? Well, here are some statistics that may sway you. According to Consumer Reports, 80% of adults in the United States suffer from back pain at some point in their life. Back pain is the 5th most common reason a patient will seek doctor treatment. 14,000 people surveyed with back pain last year, and half of those, the pain was limiting to their daily routine. Of the people surveyed, 46% of people said that it affected their sleep. 31% it affects their ability to maintain a normal weight. And 24% of people say that it affects their sex life. Of people surveyed, 59% of people say that chiropractic care they were highly satisfied with. And 58% of people preferred chiropractic care over massage and physical therapy for ailing back pain. In closing, I hope that me talking to you today has helped you understand that chiropractic care helps people in multitudes of ways, not only for backs, but for many other conditions, as I spoke about earlier. In breaking down that first appointment, I hope you've become less tense in scheduling a consultation and understanding what exactly the treatment that chiropractic care provides. Since I began speaking, there have been 62 car accidents in the U.S. alone, and of those, 50% of them end up with bodily harm. In agreement with Dr. D.J. Lawrence, who states, "You take broken items to those who can fix them, just as you take broken backs to a chiropractor."
Are you done now? Mommy, can you go black?
I don't know how to stop it.